Welcome to Lesson 22. This is the ICH Q9 Quality Risk Management. In this lesson, we will be looking at the ICH Q9 guidelines, what is quality risk management, examples of where to use QRMs, and the QRM process. We talked in our previous lesson about quality by design and how that's broken down into the three ICH guidelines. So we looked at ICH Q8 and Q10 in our previous lesson. Now we're going to be looking at ICH Q9 Quality Risk Management. Quality risk management was a game changer for the pharmaceutical industry. It brokered the regulators' first approach to using science and knowledge to make decisions other than what was mandated by strict rules in the GMPs. If you log into the ICH Q9 guideline here, you can see the content of it. Again, I would recommend that you do. It's in your appendix section. Have a look and have a read of it. Quality risk management is defined as a systematic process for the assessment, the control, the communication and review of risks to the quality of the drug, so that's a medicinal product, across its life cycle. What is risk? We conduct risk assessments every day when we cross the road, when we decide whether we are going to use the piece of ham that's in the fridge and it's out of date by 2 days. We do it every single day and we don't really think twice about a lot of it. So it's intuitively, we understand it as being something harmful. There are two key components of risk: the probability that harm will occur, and what would the severity of that harm be if it was to occur. To effectively manage both risks, we have to address both components of risk. So we multiply the probability by the severity, and that gives us our risk factor. So what is quality risk management? There are lots of definitions for what quality risk management is. You'll see some in the ICHs and in quality literature in different places. But the common objective behind a QRM is to identify, to measure, and to reduce risk to a predetermined acceptable level. So we're going to say our knockoff for the level of risk we're prepared to take is X, Y, or Z, and beyond that, we won't continue with this process, or we'll make mitigation factors, or we'll invest money to reprocess it, whatever we decide to do. But our predetermined level of risk is set up front before we start. So things that you could use a QRM for, you can use them in lots of different aspects of a pharmaceutical or biopharmaceutical site. So when you're making changes to something, if you want to identify weak points in a process, if you want to identify the best corrective action for something, if you want to confirm the product quality or its safety, if you want to determine the critical components in a system, if you want to determine the critical control parameters in a process, and we want to determine what items in a facility require validation. These are just some of the examples that you might use a QRM for. There are many, many more. So from the ICH guidelines, this is what the typical QRM process looks like. It's broken down into three main categories. The yellow box here is our risk assessment portion. The second part is our risk control portion in a green box. We've got our outputs, and then our red box here is our review of events. So in our risk assessment, we're looking at risk identification, what might go wrong or what has gone wrong. We look at the risk analysis. What is the likelihood or the probability, and what are the consequences of the severity of that risk? Then we will evaluate the risk. What is the level of risk when we take all of that into account? Are there any mitigating factors we can put into place? When we come to our risk control, what can we do to reduce the risk that we've identified? Are there things we can put in place to reduce that risk so it's more amenable to us? Or in certain cases, we might say, well, we're prepared to accept that risk because it's low or medium risk and we're not really too worried about it. We're going to keep an eye on it, but we're prepared to accept that level of risk. And again, we would have to document and using our justification and rationale for all of those decisions. The risk review portion needs to occur as well to make sure that we're keeping an eye on the big picture. So the QRM process here, which we've just gone through, this model is based on ICH guidelines. So this is a very simple way of looking at the process overview. Our first task is to identify the risk question. Then we're going to select a risk assessment or a tool methodology. We're going to look at the risk assessment, and as part of that, we're going to identify the risk, analyze it, and evaluate it. Then we're going to look at risk control. What can we put in place to reduce the risk? And documentation and communication is really important throughout the whole process. At the end, we're going to have a risk review. Number 1, identify the risk question. So clearly defining the initial risk question or the issue is essential for an effective QRM. And you might think it's a straightforward thing, but this actually takes a little bit of thought because you're setting the boundaries as to how your investigation is going to go based on your risk question. So you should really have a good think about it. The risk question assures that resources are effectively applied. It identifies any background or preliminary information, assumptions, or data on potential hazards relevant to the risk question. It also identifies the necessary resources, responsibilities and accountabilities that you might come across. It also helps us to select a QRM tool or method, and it helps us to remain focused on the business objective. This is an example of a risk question. So 3 batches of packaged product from a site were released with an error in labelling. So a risk question might look something like this. What is the patient and compliance risk associated with these 3 batches in the marketplace, and what actions, e.g. recall, informing health authorities, if any, should be taken? When we break down that risk question, we need to know, well, what is our scope? Our scope in this case is our 3 batches. What is our outcome? What actions would we need to take? And we've identified that it might be recalling, informing health authorities. And what are our risk factors? Our risk factors are the patient and compliance. The next thing we need to do is look at our risk assessment tools. So the risk assessment tool helps us to organise the information so that we can analyse it. It produces an output which is typically either a quantitative, so an estimate of risk in a numerical, or it can be qualitative, so it can be descriptive of your risk, so it can be high, medium or low. There is no single right tool, and there are a lot of tools out there. We're going to be talking about some of these tools in our next lesson. We want to examine your circumstances carefully and select the simplest tool that's possible to use. There's no point in doing something very complicated for a very simple, straightforward risk assessment. This is an example of some of the different types of tools you might come across. So simple ones might be something as simple as doing a process flow chart, brainstorming using statistical tools, risk ranking and filtering, which we're going to have a look at in a few minutes, preliminary hazard analysis as well. The more moderate QRM tools, the ones you might hear about in more in-depth assessments, would be FMEA, FMECA, HACCP, and variation risk management. Ones you might come across in a more detailed, more complicated, complex problem would be probabilistic risk analysis, decision trees, event tree analysis, or fault tree analysis. You might use all of these tools or none of these tools, but it's just to give you an idea of the range of tools that are actually out there. So number 3 is our risk assessment, and that comprises of our risk identification, what might go wrong. Our risk analysis, what is the likelihood or the probability that it will go wrong? And what are the consequences, the severity if it does go wrong? How detectable is it? So if something is very detectable, we might be able to withstand a higher degree of risk. If something is very hard to detect, we might need to settle on a lower level of risk. So risk evaluation compares the identified and analysed risk against certain criteria, and it helps us to decide what risk control we need to take. So number 4 is risk control or risk reduction. What can we do to reduce our risk? The effort used to reduce the risk has to be proportional to the risk. We're not going to spend a huge amount of money, a huge amount of time and resources to reduce a very low risk to make it slightly lower, because it's not a good use of our resources. In an ideal world, we might do that, but in a busy pharmaceutical or biopharmaceutical site, that isn't feasible. So we need to put our energies into where we're going to get the most benefit and where the highest risk is. So we need to take action where possible or needed in order to reduce or avoid a risk. If we can remove it entirely or engineer it out, that's the best case scenario. If we can decide whether or not to accept the risk based on the assessment and control efforts. So we might say, okay, we can live with this risk. Our chances of detecting an error, if they were to occur, is pretty high, so we can live with the risk as it is, and we would document that up and justify it. So that's the decision and the action step in a QRM. Number 5 is your communication and your documentation. So communication is part of the entire process, our data collection for risk assessment and during our decision making for risk assessment. Communication and documenting the output of a QRM process is really important, and we need to do that to all our stakeholders and for use in other businesses or work processes if there is a knock-on impact. Risk review is an important part of the process. The risk management should be an ongoing part of the quality management process and would feed into your quality management systems on a site. A mechanism to review or monitor events should be implemented. So we talked about our basic process overview. We identified what the risk questions should be. We talked a little bit about selecting a tool or methodology. We talked about the risk assessment, identifying it, analysing it and evaluating it, what risk control strategies we could put in place, how we communicate and we document our risk, and then our review at the end. We're going to look at this process in a little bit more detail in our next lesson, but this gives a good overview as to how you would approach a QRM. I just want to give you an example now of a very simple QRM and how it might look. So our risk question is, what are the risks of driving my car to Connemara to go hiking this weekend? So the first thing we want to do is to identify what are the risks. So we might have adverse weather. The weather's been pretty bad lately. Could there be snow or ice that might cause us to have an accident? My car has worn tyres and it needs new brakes. That would be a risk. I might be very tired because I'm going after work on Friday and it's a 4-hour drive. I'm going to stay till Sunday afternoon and then drive home after all my hiking, so I might be really tired. I could have an injury due to an accident on the road, and there might be other risks as well, but this is just to give you an idea. So we've identified our risks. Our next step then is to look at our risk analysis. What is the probability of each of these happening? And if they were to happen, what would the severity be? Well, the probability of adverse weather is medium. And if it was to happen and there was snow and ice in Connemara on those open roads, the severity might be very high. My car does have worn tyres and needs new brakes, so that probability is high, and the severity of something happening as a result of that would be a medium I'm going to give it. Fatigue, the probability of it is low, but the severity, if it did happen, would be medium. The injury due to accident is probably unlikely, but if it was to happen, it would be high. So we've got our risk ranking matrix here. So what you have is you've increasing probability going this way and increasing severity going this way. If we have something that we rank as a high probability and a medium severity, it's going to bring us here on our chart, so our result will be high. If we've something that we've ranked as a medium probability and a low severity, it's going to bring us here on our chart and we're going to give it a low score. So we're going to look at our risk evaluation. So for adverse weather, I've said the probability is medium and our severity is high. So probability is medium and our severity is high, so that gives us a high risk evaluation. For my car tyres being worn, the probability is high and your severity is, I would give it a medium, so that also gives us a high score. So I've got low probability and I've got medium severity. That gives me a score that is low. Injury due to an accident, I have a low probability and I've got a high severity, so that gives me a medium risk. And you continue on until you have assessed all of the risks that you have, so you end up with a matrix. Once I've done that, then I need to look at, can I take actions to mitigate these risks further? So for adverse weather, snow and ice that might cause an accident, control actions I could do would be to check the weather forecast before I go. And based on that, then I'm going to do a new assessment because I've seen what the forecast is, so I'm going to give myself a low when I go through the process again. My car has worn tyres and needs new brakes, so I could have my car serviced, or I could drive my spouse's new car, and then that will mitigate my risk to low again by going through the process and reassigning my probability and my severity and evaluating it. Fatigue, I could drink lots of coffee when I'm driving, or I could depart on Saturday AM. So again, I could reassess my criteria based on those and come up with a new score. And what might that be? You've got your original risk scores. You put your mitigating factors into place and you put some control actions in place. Then you need to go through the process again and you rescore it and you might get a different score. And you keep doing that until you get to a point where you're happy to accept what the risk is. So our risk communication and documentation. In this case, I'd make sure I tell my family where I'm going for the weekend, what time I'm due back. I'd write down the name and the number of the hotel I was staying at. And I would check the forecast again on Thursday to make sure nothing has changed before I go. If I found out that my spouse's car was impounded for illegal parking, would I still go? So again, that's changed my scores and I might have to go back and reassess then on the basis of driving my own car. Would I get it serviced? Would I be prepared to take the risk? So that's how a QRM would work. So it's quite it's a very logical means to approach a problem and to assess a risk, to say, well, what is an acceptable risk and what is not an acceptable risk. Over to you. What is ICH-Q9 all about? What are the 6 components to performing a QRM? Can you think of examples of a risk reduction that you have seen or used? Thank you very much for your time and attention. We'll see you